here because as chiropractors, we'll be just releasing, whether it's the hip, the sacroiliac joint, vertebrae, or even if it's the knee itself or the foot, doesn't really matter. You can do an articulation or a high velocity thrust. You can do a low velocity thrust or a high velocity thrust and put a sudden force through the area there and release it. The only reason why I have issue is because if this is the approach and the muscles in the area are not deactivated, if the fascia has not been lengthened, doesn't matter if it's the knee, hip, back, doesn't really matter. If that hasn't happened and you just release the joint and you release that gas, the muscles are still tight. So then it's just going to take maybe a few hours, maybe a couple of days, maybe tomorrow. You go sleep, the position that you hold yourself when you wake up, and that muscle is still tight. All you've released is the pressure, and you've released the facets. Facets have become unstuck, which is what are gliding over each other when it comes to doing a high velocity thrust in the thoracical area or the lumbar along the spine. But even if it is a hip or actual big joint, if the muscle isn't released, that pressure is going to build up again because all it was took place is that you released the pressure inside. You didn't deactivate the tissues or loosen up nothing else. So this is why osteopaths out of this approach probably are far more better, because they will do soft tissue work, then they'll do a high velocity thrust or something, depending upon it.
Yeah, I totally agree. Because, and it's not true for every chiropractor. I mean,
yeah,
because what we're having now, we've got different discipline who's stuck to their school of thoughts. But now, I mean, the true practitioners not really even going by what they're called anymore. They've got their label, they got their title, but they can do a wide range of things.